we can make a difference every day. When we announced that on October 1st, officially, right, we said October 28th, we can make a big difference. The last effort of the last 7 days will pay off in the next few days, because you know that the gesture, the way we react, the way we apply those measures will have an impact in the 14 days following. So what I'm commanding the Quebecers is we'll see in the next few days if our tough measures and the way we have been reacted are paying off. That's for the first 14 days. And the vision we have with the expert is the first success, and we need some success. The population, when we call that, we need win. We need some, sometimes we say low-hanging fruit. We need to have a win sometimes. And the win that we can have in the next few days is really to stabilize the number of cases. If we were able not to go as we've seen, 600, 700, 800, now we are in the 1,000 area. If we could just see a stabilization of that number in the next week, that would be a first win. That would be for the first 14 days. And then the Quebecers will say it's working, right? The second win would be if we continue over the following 14 days, can we see now a decrease? And I'll tell you, when it goes down, and we have experts that are analyzing that, it makes a big difference, because when you start to see the diminution, the decrease, of those, the outburst of being at 600, they would go down to 500, 400. I think that would make a big difference. So I don't know where we're going to be at the end of October. But I know one thing, if we have those two wins, the stabilization first and some of the decrease in the second part of October, to me that would be a very big win. And we'll give you this information because, as you know, what I think is clear, and I'll finish with that, is all those gestures, all those things that we do right now will have a big impact in the next 2, 3 weeks, 4 weeks. And what we will do in the meantime is update you every week, as we did last week, what is the impact on hospital and how we are managing our hospital system. If Quebecers, and I think they understand that, we will keep them, we will inform them of the benefit of succeeding in the next few weeks. And I'm saying, as I said before, let's make sure we show to the nurses and all the personnel in the hospital that we are doing that for them. Because if we're successful in our health system, we can continue to have our kids at school, and we can continue for our people to go to work. That's really the two success that we would like to have in October.